Welcome back to A Closer Look. March is Women in History Month, a time to focus on the empowerment of women and celebrate their contributions. Today we're talking about women in the healthcare industry. Joining us is Chesapeake Regional Healthcare's Chief Operating Officer and Chief Nursing Officer, Dr. Amber Egyud, and Dr. Kelsey Williams. Welcome to the show.
Thank you.
Now tell me why you decided to join the healthcare industry.
So I grew up in a family, my family actually runs a funeral home, and it's been in our family since the 1800s. So I grew up in an environment where serving people in a time of need was really important. And so I think just growing up in that culture, it was a natural fit to choose something like healthcare. I had the opportunity to shadow a surgeon when I was in high school and fell in love with the operating room and medicine in general and just decided to pursue it. But I think the medical field is so amazing because it's always changing. It's a fast-paced field. It's not stagnant. And so I think all of that wrapped together, it was a really good fit for me. So.
And from as young as I could remember, I've always wanted to be a nurse and to serve others. And nursing is such a diverse profession where you have the opportunity to not only serve people through healing, but also as an educator, an innovator. They're advocates for patients. And most importantly, there's a role for nursing from the bedside to the boardroom. So it's a profession of service. And that's from as young as I can remember what I wanted to do is make a difference.
So it sounds like you both had a calling.
Yep,
which is great. Now, what positive changes for women have you seen during your career in healthcare?
So well, I'm early in my career,
right?
Just starting. But I can say, from what I've heard in the past to what I experienced coming through training as a physician, it used to be a very male-dominated field, especially in the field of surgery. My residency program was actually almost a 50-50 split, men and women, which is, 20 years ago would have been unheard of. So I think just the opportunity to pursue something that traditionally had been male dominant, and having that opportunity to step into a dream, a passion of mine, and be able to see that fulfilled, I think that's a huge advancement for women.
And then from a professional perspective, during the course of my career, what I think we have seen such a trajectory, and although we still have a steep way to hill to climb, one of the things that has happened over the last 25 years is the presence of females in C-suites. So typically it is dominated by males, and even now in the United States, most healthcare industries are led by male CEOs, and typically females have only served in the chief nursing officer role, and now we're starting to see the emergence of more female leaders outside of the chief nursing officer role, which has been a good change.
Because you're the chief operating officer as well.
Yes.
So that's a pretty big deal.
Yes.
I would think so, right?
Yes.
Right? So what advancements are you hoping to see regarding how women are employed, specific to the healthcare industry?
I think one of the advancements that will be nice to continually see is more women in executive positions, not just in hospitals, but in insurance organizations, other industries across healthcare and non-healthcare industries where there are more women infiltrated into boardrooms and into typically held male positions. And then also from a salary disparity position, there's a lot of literature out there where there's a huge disparity, even when females do get to the C-suite, about pay inequities between executives. So I think that's some of the positive changes that are coming about, where there's equality in pay and equality in positions.
And you would think if you're doing the same position, that you wouldn't even have to have that challenge of having different salaries, but it's a real thing.
Yes.
So, and hopefully that is changing, without a doubt. Now, would you say there are specialties within the industry where women are more dominant than men?
Absolutely. Nursing is a predominantly female profession, and even if you look at frontline levels of leadership up to the chief nursing officer roles, they are heavily dominated by females.
And on the flip side, are maybe we're seeing more males enter
Yes,
the
we
nursing
are.
field, which is good.
We are, and we hope to increase diversity within nursing throughout all positions from the bedside up to the executive level, and we are starting to see the emergence of many more male CNAs, which is a nice change because it's a good perspective.
And I think a lot of it is, I don't know whether it's just how it's always been or how it's portrayed on television sometimes or things like that, but it's great that people who have that calling can choose whatever field that they want to, and hopefully that day will come where nobody will even think twice about it.
Right.
So now, how would you say healthcare has changed for women as a result of talking more openly about women's healthcare issues?
Yeah, I think specifically in my field of dealing with breast cancer patients, there's, even in some of the research that's coming out, there's much more attention being paid to the patient themselves and some of the psychosocial and emotional side of things that go into caring for a woman with breast cancer. It used to be that if you were diagnosed, you had a radical mastectomy, a very disfiguring operation wrought with complications. And a lot of the research has shifted towards how can we preserve the breast, which is, from an emotional standpoint, is very important for women. So I think incorporating some of those aspects into care for women has really been a change in more recent years. And so my consultations usually involve more of they don't come in and I tell them what to do. For a lot of women, there's a choice, and it's a conversation of, what do you feel like you would want? And so it's more of a team sport, a conversation between physicians. And so I think that's been a shift in more recent years in dealing with women's health issues.
And I think that's great for somebody to feel there are options.
Right,
and to be a part of that decision-making process.
And I think as we see this shift in accountable care organizations and focus on preventative care, we have the opportunity to not only put in the forefront that women are different in ways that they are not in breast health, in cardiac health, in depression, and other psychosocial issues. I think the opportunity to have free preventative assessments is really helped and come a long way to free breast exams, to free cardiac prevention assessments. So I think that the more we do in prevention of women's issues, the better outcomes that we'll see for overall women's health.
And awareness and education is a big part of that too, I would think.
Yes.
Back even in my lifetime, I don't remember that we talked about it. You just didn't discuss certain things like that. Now it's a common day occurrence to talk about mammograms and the breast center and the prevention that can play a big part in the quality of life and the longevity of life as well.
Right. And there are multiple studies with mammograms, like prevention, it saves lives. And so there was a recent study in Sweden where they looked at over 50,000 breast cancer patients, and women who were enrolled in a usual mammogram screening program had a 60% decrease in risk of death from their disease. And
That's great.
By talking about it more and encouraging women to do these preventive studies, we're saving lives, which is huge.
It's great. So we're making leaps and bounds.
Absolutely.
So that's so great. Thank you, ladies, so much for joining us today to talk about women's healthcare and empowerment and how things are changing for the better.
Thank you.
Thanks for having us.
Appreciate it.
We appreciate it.
We have to take a quick break, but up next, find out how the Girl Scouts have been empowering young women for years. Don't go away.